everybody. Welcome to an apple a day with Dr. Amanda. So I am so excited to be back. We have a part 2 with Craig Miller, and we were doing a series, right? Our theme for the week are overcoming anxiety and depression during hard times. Now, Craig had talked to us about anxiety during part 1 and gave us amazing practical coping skills and background on how anxiety may continue through families even, and gave us lots of wisdom about that. Now in part 2, we're going to be going through and talking about how to overcome depression. Now a couple things before we go into that. Remember to like, share, subscribe if you are enjoying the Apple a Day with Amanda, Dr. Amanda series into part 1 with Craig Miller. He is a therapist, an author, and a speaker, and he has many resources that he shared in part 1. Now you can catch the podcast. You can also catch the YouTube video on an apple a day with Dr. Amanda and catch into that anxiety talk that he had shared. He also has a website, Insights from the Heart, and .com, and he also is a co-owner of Masterpiece Counseling. So again, Craig, certainly also goes on many shows. If you go on his site, he had talked in our first session and just really communicating about how he has many practical resources on his website. So again, Craig, it's wonderful to have you back, and I certainly am really looking forward to us talking about how to overcome a really hard topic, which is depression, that most of us may have had encountered. How do you identify when you have depression?
All right, well, great. I'm so glad to be on your show and talk about this topic of depression that is so common. There are so many people that I see for depression at our practice in Masterpiece Counseling in Tecumseh, Michigan, which is by about an hour and a half southwest of Detroit area. Whether it's at churches or just other venues about this and about how overcoming it. I really want to share this because it's really important that people recognize about depression. See, there's a healthy side of depression because, you could have a blue day or you found out that your dog died, so you're going to be down. You're going to be depressed about that. And so, you can have a sense of sadness about something that happened. You even failed a test, for example, you're going to be down about it. So, but what I want to talk about is more of a constant sadness, like a helplessness or a hopelessness. It's not about a blue day, it's about a blue life. And so this involves your body and your mood and your thoughts, and where you're constantly down about something, you lost interest and lost motivation, you have sleep problems, appetite changes that are not good. You either eat too much or you don't eat enough. And when it gets really bad, it's like you don't care about life, you don't want to live, especially if you're suicidal. For adults, this sadness I'm talking about is really more obvious because for adults, Amanda, you would sense it by what I just said. You'd actually see it. You could say, hey, I'm having sleeping problems, or I'm really down right today and I don't understand it. I just don't have any motivation to do anything and I don't care about anything. So as adults, we can identify it and then we can actually say it and talk about it. Not everybody does that, but you have the ability. Whereas in children, it's less obvious because they also have this problem. Children will be more withdrawn. They'll have more of an attitude issue. Of course, adults can have an attitude issue. And there's more behavior issues. Like they'll fight more with their siblings, or they'll give you an attitude about something, or they don't want to do something. And that's usually because they're mad or they're depressed about it. So it doesn't come out as clear. So if you notice there's a behavior problem, differences, things that are different than normal in children, ask them about it. That's the best thing. Even if for adults, ask the people you care about, hey, you seem kind of different lately. What's happened? Now, they're either going to know or they're not going to know. So, for example, if they know, that means there's an event you can deal with. If they don't know, that means there's an accumulation that there was an event in the past, but it's accumulated enough they've been hiding it or they've been holding on to it, and eventually it still comes out. And something small typically triggers it. Okay. So let's talk about then. You mentioned anything about that, about the the types though of before I go on about dealing with hard times, anything that you saw from what we talked about the type of reactions you have from depression.
I mean, so I guess I am curious, you know, when you're talking about depression, do you find, and you may have said this in some way, that boys and girls, like males and females, tend to respond differently in terms of the, you know, the internal, external with depression? Like, do you notice that in your practice?
Yes, well, now that's a good question. I had not actually said anything about that, and that's a very good question because there is a difference. Now, women in general will tend to be depressed more than men because of they have a lot more feelings, and their feelings tend to overcome them more than men. Because they have more feelings and more aware of them, and then they can then push them down more, which makes them more depressed. And men are less aware of them just out of not being able to know. But the problem is there's more actually ending of life and suicide with men than there are with women. So I'll explain why. When we're born, when we're created, male and female fetuses have the same type of brain. So on the right side is the emotion side, creative side. The left side is the logic side, and it's the memory side. And so it works at the same time. And then at the 7th week in utero, when our moms are pregnant with us, testosterone washes over the male brain, and it damages. There's a 3-strand cord in the back of our brain that connects the right and left hemisphere. What happens is that testosterone damages that brain so much so that for males especially, information comes in on the left side, which is the logic side, memory side, but has really difficulty crossing over to the emotion side. That's why when I work with marriages, quite often the spouse will get really furious at the male because they don't express their feelings really well. They don't talk about feelings. They're not on the same page with things. That's because the male doesn't work the emotion the same as the female. The female brain is constantly working right, left all the time. So emotion and logic at the same time. So when the woman talks about emotional content to the guy's going, because the problem is he's not there.
Yeah.
So the woman gets upset, and when the woman gets upset, the guy shuts down even more because of what's happening. So it gets worse. So I always tell the female, listen, don't push the issue about what they're feeling or what to respond right away, unless it's the logic part, because they will shut down. And so give them a moment to think. So ask them what do they think rather than what do they feel, especially. Now, we are created, I believe God created us as opposite for a reason, because the female does have more emotion, to have the content of seeing that. The male may have more logic. Now, we both will have that. I'm just saying overall. So when you bring them together, they should be able to work together in tangent really well together. But when they're not, they work terribly together. And that's what I always tend to work with. Anyway, my point is that the more feelings we hold in, the more depressed we can become. See, there's 2 major reasons for depression causes. Now, the first one could be a chemical imbalance, which we could be born with. The second reason is we holding in our feelings. So if you were born with having that difficulty for men having information come over to the emotional side, it does. So it's supposed to come over, and it does eventually. It's just that, and men will even use it as an excuse not to go there. And that's just an excuse, because eventually you can. But what happens is, if you grew up in a home then where big boys don't cry, stop your crying if you're gonna act that way, even for girls, or they're put downs and you're not allowed to cry, or even emotions aren't allowed, they're not encouraged. If that happens, then what happens is I'm not gonna have them for the rest of my life. What I learned in childhood is gonna transfer into adulthood. So what happens is it's interesting because our childhood, in childhood, the environment, outside environment creates the internal belief of my reality. So if somebody's yelling or somebody's depressed growing up and they're all depressed, that's how I learned about depression. I talked about last week, if you're live in a home that's anxious, there's a lot of yelling going on. If a mom was very anxious or dad was, then that's how I learn about you're supposed to be anxious. It's like my learning I'll say even in the Bible, Proverbs 22:6 says this, that parents' job is to train up a child in the way they should go, and when they're older, they won't depart from it. So when you're growing up, how your parents were is your learning curve to how you're going to deal with stuff. So if your mom was depressed or your dad was depressed, you're probably going to be depressed. But the issue is that was given to you. You don't have to have it.
Sure.
Don't let anybody ever tell you that you have to live with depression or anxiety or sadness or compulsive disorder or whatever it is, even a physical ailment. Okay, because this is all given to you. So you have way more power than that, and you need to say, I need to continue to seek my healing until I find it, because I don't want to live this way. And you've got to decide it. That's how I work. What I do basically is I don't settle with maintenance. I'm not a maintenance therapist. I'm a terminator.
Yeah.
All right. So if you want to get rid of that stuff, go find somebody that knows how to. And if you're going to be with somebody that just lets you count to 10 and then deal with it and you maintain it, don't do that. Find somebody that'll help you work it. Now, it's really important that during did I answer your question?
No, you did. And I wanted to just say, I believe you talked about, how to identify anxiety. And I did ask about how males and females do respond differently. And I loved what you said. And this might help some people in the audience, because if you're in a relationship, if you are a man, right, usually as a woman, you said that we should ask the man, what are you thinking, right? Instead of what are you feeling? And the man, a nice tip for men might be, what are you feeling at the right time, right? Because again,
Yes.
I love that difference, and giving that pause. So that was important. And I believe, Craig, you talked a lot about causes of anxiety. I don't know or not anxiety, I'm sorry, of depression. I'm not sure if there's anything else, because you did talk a lot about, what happens earlier. And the only other thing I do want to note is that I loved how you said that sometimes we tend to, right, unless we realize it, say, oh, well, my mom had this, or my mom, carried depression, so I have it, or I'm just like my mom, I carry depression. What do you hear that a lot, and what do you have to say about that?
Well, let's start with it. Let me give a little bit more reasons for having it. Remember, you can have things happen like your car was dented and get really sad or mad about that, or you failed its driver's test, or I don't know, anniversary of somebody's death, like a year ago, somebody passed away. Those are normal reasons to be depressed, all right? And so similar to anxiety, again, if you get anxious about something, same thing with depression. Healthy functioning for depression is after that anniversary time is over, or after you start getting your dented car fixed, you should bounce back. You should not be depressed. Depression should only be short-lived. In fact, and especially when the issue is resolved. So the problem is, though, the unhealthy depression is when it doesn't go away, and like, what do you do with that? And that's the problem. Most people don't know. Again, it's either a chemical imbalance, which is a less of it. And you can, as far as I'm concerned, if you're a person of prayer and a person of belief that God can bring healing, then pray and ask God to change that chemical imbalance. I mean, there's medications out there, but at the same time, and that's something you can seek if you need to. But we need to also recognize that the biggest part of it is I've been holding in my feelings. Most people that are depressed is because I've been holding in feelings and not been allowed to. So you have to create the ability to release what I feel.
Yeah.
See, as a child, we have a natural ability to release. So let's just say, if you grew up in a home where you were not allowed to express your feelings, then you're going to hold it in. And the more you hold it in, the more it's going to make you depressed. I mean, that'd just be normal. to
Yeah,
be depressed about it.
sure.
So that when you have things happen later on, like a car dented or an issue of something happened, you're going to get more depressed because it's already there. And so this makes it worse. So this hard time that we're having now, like I say with COVID, what's happening is I'm going to feel this loss of control of what's going on in my life. Like I don't know what the future holds. I don't know when I'm going to go back to work next.
Mhm.
Those things that make us not feel in control, that make us feel like that something's not right or something bad's going to happen, that's going to make us way worse.
Mhm.
It's because if you grew up in a home that had similar feelings, like I didn't know when my dad or mom's going to get worse again, or I don't know when something's going to happen, or my father loses his job and we have to move, or like bad things happen. So if you never learned how to deal with bad things, like for example, there's a Dr. Kenneth Pelletier, he's an MD. He wrote a book years ago called Mind as Healer, Mind as Slayer. And he said, this is a quote from his book. He said, stressful experiences, especially in childhood, create within you certain methods of coping with your problems, which become the routine of how you handle stress later in life.
Wow.
So what happens is if, as a child, I mentioned earlier that our external world determines our internal belief of reality. So if there's things going on around us in our external world as a child that are not good, overwhelming, depression, anxiety, people are that way, that's going to be my belief of the way reality is. And so then I grow up into adulthood. And then in adulthood, my internal belief of reality then creates my external belief of reality.
Mhm.
So if I'm already anxious because, or I'm depressed because of, I'm already sad about how life is. So I'm just going to believe that's the way life is.
Sure.
And so I don't believe that. I believe the fact that that's what happens, but it's called learned behavior.
Sure.
That's called learned helplessness,
Mhm.
Amanda. And like, why would you want to live that way?
Right.
So first of all, so do you have any questions? Because then let's go into then in a moment. I want to say if there's any questions you have, then we can go in ways to cope with it.
Yeah, we can certainly go into ways to cope. I think the other thing that you're really touching on, Craig, in terms of that mindset, it really is a mindset shift, because a lot of times if you do have depression, or again, if there's been past trauma, right, that sometimes obviously may happen, you almost become a victim, right, rather than victorious. So a lot of times you end up telling yourself, well, this is how I am, right? Or you might believe some things that are, that keep you from moving forward, right? And that'd be a process. And I like how you said that a lot of times you tend to stuff that down, with depression. It's almost like what I heard you saying through it was, it's almost like you have to give yourself permission, right, to feel. If you've never had somebody say you can feel, and a lot of you may in the audience may have had people say, no, you can't talk about that, right? Or no, we don't talk about that. And know that that's healthy to actually communicate how you're feeling. And so that's a lot of unlearning, right? Like you said, that learned helplessness, or learning how to prevent yourself from actually moving forward and being free from those emotions. And I think that happens quite a bit.
Right. So you're correct. So it's a lot of it is learned behavior, like I learned how to be depressed. But unfortunately, the longer we've lived with something, the longer then it becomes my identity, because I have to learn how to live with it. And that's what I know to do.
Sure.
And so the longer you've lived with depression or anxiety or even a physical ailment, the longer then it may get harder to get rid of it. Though, I mean, for God, it's not hard. For myself, when I work with people, it's not hard. It's what's going on inside of our mind and what we need it. It's like we need it to survive, because that's what I know. I've actually had people that depressed for so long that they're afraid to let it go because it's their friend.
Yeah.
And it's because if I let this go, I don't know how to be happy. In fact, it's scary.
Wow. That's really huge. And that almost reminds me of, like those safety blankets, where people have a blanket. It's almost like you're carrying something, because what happens if you release it? And that's really, powerful. So some of you out there, and this is a nice segue, into coping skills, Craig. So now a lot of you out there, and again, we want you to know, like, there's no shame in your history, of this. There's no shame, this is something that We have to learn, and it's okay if you're wanting to start out learning how to do emotions. I want you to know, that this whole point of this is to help you. Like, if you're hearing this and you're like, oh my goodness, I'm tended to carry this. We want you to have hope and know that there's a better way, and it might take some time. Sometimes there's a process, but to have hope. So Craig, for those who are listening, maybe they're having hard times with COVID, depression, or have had hard times, and this has just made it, the state of the world made them even more depression. What are some things that they can do that will help them?
All right. So first of all, you need to identify the fact that it's something that you shouldn't be living with. If you've been living with it a long time, a lot of people, I'll say, Amanda, they are living with it because they don't know anyone else to get rid of it.
Sure.
They don't know how to get rid of it.
Mm-hmm.
And so, my heart goes for those people because you shouldn't have to want to live with that.
Mm-hmm.
You know who wants to. So does what you're feeling now, this depression, does it stop you from living life? Do you feel not good enough, or can you not bounce back and bounce into doing things better? If that's the case, then it's something that, yes, it's something that you shouldn't want to have to live with. And even, are you suicidal? Do you not want to live anymore? I would definitely, for any of those watching this, seek a medical attention, definitely, like counseling, and see a doctor to get on something right away. Medication, there's many types. There's natural remedies, there's obviously prayer, and there's psychotropics or antidepressants. And usually the more serious it is, the more I recommend something as soon as you can get on it, because I wouldn't want anybody's life to be lost over that. One thing I didn't mention is dietary. I also notice, Amanda, that foods that are very processed foods, or a lot of pasta, and a lot of not whole grains are better for us, but when it's processed foods and
sugars,
sugar and bleached flour, that's it.
Yeah.
Everything meats, like white bread and so on. Oftentimes the nutrition has been worked out of. That's why it's bleached flour. So a lot of the pastas that you eat, that actually turns into glucose, then turns into sugar, and then brings us a sugar low. So there's a sugar high, then a sugar low. Like eating a lot of sugar, pops, desserts, and so on. So you get the sugar high, feeling better but then there's a great decrease. So that can bring on depression. I seek talking to somebody, a naturally minded health professional. Prayer is really big, important. Even for the seeking for anxiety, I didn't bring that up as much before, but prayer is really important. Seek counseling, of course. And so, one thing we want to go into, I do recommend, before I give you actually some real practical things, is my book, Breaking Emotional Barriers to Healing, is one that I would recommend. That one, it is more of a faith-based book, but it's really important. It gives you reasons why you feel this way, things that you could do. If you're living with a spouse, for example, that doesn't express themselves very well, you want, when your mate's emotionally checked out, that book is also important. And also, it is a book here, if you grew up with feelings don't come easy, but then turns into depression. One of my first books is When Feelings Don't Come Easy. You can get these on my website, insightsfromtheheart.com, or you can just get them off as Amazon. All of them are on Amazon. All of them are, of course, paperback, Kindle, ebook, and some of them are audio. There's one other one that I have, is if you want more declaring who you are and to believe in yourself, this book is Declaring Your Worth. It's about 16 chapters. They're about 3 pages each. It's more of a devotional or an encouragement book, inspirational book. And it talks about healing that I've done in my office or on the street, where somebody was miraculously healed of an issue of how they felt being not good enough, unworthy, not feeling loved, feeling blamed, feeling helpless. And we just get out of that, so you don't have to feel that way. It gives you an idea of how to do that. But the most important thing is find the time, when you're feeling depressed, and ask God or ask yourself when you could go back in time when you first felt that feeling. and go back in time as far as you can to find that time when you felt that sadness. And then think of somebody in your life that you could put there in front of you, be with you to comfort you. The biggest reason why we're so sad is because it was a time that we were not comforted. So think of a time of somebody that could comfort you, an aunt or an uncle or a parent, or especially like Jesus or God, if you're, or Mother Mary, if you're a person of faith. Just see yourself by giving yourself a hug. Think of yourself of that person being with you. Close your eyes, see them there, and give that sadness away to them, and even give yourself a little love pat, like you would if you're holding somebody and you're giving them a love pat on the back, saying it's going to be okay, it's going to be okay. Speak words of life into that person and letting them know that they're loved, that you are loved, that not only God loves you, Mother Mary loves you, but it's really important to know that this depression and not feeling loved was something that was given to you, and you don't have to feel that way anymore.
Right.
You should not feel something that really is not yours to keep anymore, because you are good enough and worthy. And it's important that you know that, anybody that's watching this right now.
That's right. That's really helpful. And actually, Craig, I'm glad that you showed the I Declare Worthy, because I was going to ask you or tell the audience about the Declaring My Worth book, because that is a powerful book, about truths. And I had a question, Craig. So say I'm a person, right? You had a lot of practical tips. Say I'm a person who, my thought that constantly happens is, I will always have depression. What is like one practical tip to help people capture that thought, and switch it? Like, what would you say might be helpful? Like maybe they're doing the love hug, but they're trying to repattern their brain. What would you suggest for them?
Well, first of all, the most important thing is to recognize that the negative is not something you should keep. I mean, if you are a Christian, that you were not made that way, but you were given that. And so you find out what the negative is, release the negative, and then give yourself a positive to shift that. So the Bible says that in Romans that 12, that we need to then we need to not then be conformed to the ways of the world. Then we need to transform our mind, and we need to take control of the thought rather than the thought taking control of us.
Yes.
Right?
Good. Well, thank you. Okay, so again, I really appreciate the last couple of weeks. We've had you for session 1 on anxiety, how to really help with coping skills, and you had wonderful resources that, again, any resources that Craig talked about from session 1 or this session in his books will be posted, any of his websites on the podcast. I usually give an overview, and then on YouTube. So certainly check that out. And he also talked about depression. So Craig, we really appreciate all that. But to close out, what's a wisdom tip, right? You had met much, once again, wisdom, but what's one more wisdom tip for the audience?
Well, the most important thing is, look, if as a Christian, you know that you're a temple of God, and those that may not know God, what you need to realize is that you have the only one that has control of your own body. So exercise regularly, find ways to relax, talk to positive people, pray, and involve God in your life, involve positive people in your life, because you have to take control of your life. Because when you're depressed, then you've lost control of your life. Get that back. And so give yourself that control to give it back. Someone in your life took that away from you, and it's up to you to take it back. Allow God to help you with that. Allow other people to help you with that, because that's what you can do for yourself.
That's powerful. So thank you. Yeah, take it back, right? Take back what was stolen and move ahead. So thank you, Craig. I appreciate your time. Again, those of you who are listening in on YouTube, like, share, subscribe. You also share what you've learned. And again, we'll be continuing on with our topics for overcoming anxiety and depression. And Craig, it's great to have you.
Thank you.
Audience, if you loved what you heard from Craig today, do not be sad. We're going to have him back for some other wonderful topics that will be coming up. So make sure you stay tuned.